Hi, everyone. I am Miranda Johnson. I'm a speech therapist from Sunny Days Therapy, and I am here with Dr. Courtney Stone from Affinity Hearing and Acorn Audiology. We are here today to just chat a little bit about auditory processing disorder and language processing and how our two fields can kind of work together to figure out what is going on with kids. So we both work with pediatrics, and we have a lot of fun with the kids. So to kick it off, why don't you tell us a little bit of just how you got started with working in this field, and in particular your niche with auditory processing?
Sure, for sure. I am I'm a daughter of an audiologist, so I was introduced to audiology like in obviously all my life, but working in my dad's clinic in high school and stuff like that. But with
Oh,
auditory
I did not know that.
but I did not think that's what I was going to do. I was going to do physical therapy. Actually, I was like dead set on physical therapy, but that's not how it turned out, and I'm glad. But in college, one of my professors was super passionate about auditory processing disorders, and so we had more exposure than I would say average for learning, and he was into research, so we got to be a part of his research and testing a lot of kids and adults. So I got exposed to it in college, whereas usually it's just like a class that you take in your big, lots of classes that you have to take. And then I didn't really do anything with it. I got my first job, I was practicing, and I started seeing kids coming in, and I kept thinking, oh, like this looks like auditory processing, I want to refer them. And it was so hard to find anyone that was doing the testing. And if I did find someone, then, like the next year they weren't doing it anymore. And after a few years, I just knew that it was something I needed.
It was for you.
Yeah.
You have to do it. Yep.
It was like, okay, I'm getting it. It's supposed to be something I'm supposed to be doing.
That's awesome.
So, I definitely had to get re-comfortable with it, pull out my textbooks, and I shadowed someone that I'll talk to about for resources. Her name's Dr. Ferry. She's in Chicago, and she let me watch her for a few days and just see, just absorb everything from that perspective. So that was awesome.
Very cool. Yeah, I love to hear.
The rest is history.
Yeah, awesome. Yeah, I love to hear people's stories on how they kind of got involved in the niche area of our fields, because they're so diverse. I mean, you can do so many different things.
Yeah.
So maybe let's start from there, talking about what do you see when you look at a child with auditory processing disorder? What sticks out to you as some of the most hallmark type symptoms?
Mm-hmm. So most of the time, the parents are surprised that they've been passing hearing tests or hearing screenings. So I think it usually comes from a perspective of they're concerned about their hearing. So they feel like something isn't right with their hearing, but the school checked it out and it's been fine, or they went to the doctor's office and they keep passing screenings. And actually quite often by the time they get to see me, they've thought that they've had an auditory processing test, but it was actually a hearing test. So it's been, they've known for a while that, the parents especially. So my interactions are usually first with the parents. I learn so much about the child before I even see the child, just from, talking to the parents. But they always know something is up. They don't come in like, oh, well, the teacher said we should do this, but I didn't think anything was going on.
Right.
So they, discriminating is a problem. So they can't discriminate sounds well. So they'll mix up sounds a lot, or just in their learning to speak and learning Letters, and it's just always hard. So reading is hard, spelling is hard. So it's really, if they haven't had any reading or spelling concerns, then I'd usually be like, well, I don't know if this sounds like auditory processing. but those are the main ones. It really like mimics, I think, hearing loss a lot. Is
Okay.
saying what a lot. They're mishearing things, and so sometimes it can be cute and funny when they're mispronouncing words, and that's always the question, like, should I be correcting them if they're saying something? And sometimes it is just cute, and you let them say it wrong. But if they're saying lots of words wrong, or lots of sounds consistently wrong, then quite possibly they're not processing it correctly.
That maybe sounds wrong that don't follow a typical pattern of error that a speech therapist would see.
Right. Yeah. And so every kid's going to have like a couple words that they just, and those are the words that you'll never forget, from your kid journals. But when it's a lot of them, or they're doing it and it's specific sounds that they keep mixing up, sounds that are similar, like M's and N's, or B's and D's, or T's and K's, that minimal difference type sounds.
Got it. Okay. Well, thank you.
Yeah.
So just to clarify, because this is, I think, is a big misconception, it is not due to a hearing loss, but rather like an acoustic type deficit. Does that?
Yep. So in order to, for us to even be able to test for auditory processing, the child or adult has to have normal hearing. So we know it's not related to the actual ear. So there's no damage at the ear, whereas hearing loss, there's actual damage at the ear. So we use hearing aids or something like that to correct. For auditory processing, the hearing organ is totally fine. It's just when it leaves that organ and goes up to be processed and analyzed by the brain, that's where we run into trouble.
Okay. With that, what other kind of co-occurring disorders do you see, or not co-occurring, what other disorders do you have to rule out, or what other disorders can present with symptoms like auditory processing disorder?
So I see a lot of kids who have had a lot of evaluations prior to coming to see me. And so I would say the most common ones that I see are attention. So they have ADHD or ADD, dyslexia. They may have some language processing issues, and then and autism spectrum. So we have to filter out, what we're seeing in from an auditory perspective versus if it's other things affecting it too much. So if they can't attend at all during my testing, that's going to look different than if it's an auditory processing disorder.
Yeah. Okay. So what does kind of your diagnostic process look like? If a parent were to come in or come find you, or from, the first visit, what does it kind of look like?
Yeah. So kids, depending on their age, so we can do the testing as young as 7. I can actually do testing at about 5, but it's a very abbreviated test, and it's more a screening. We can't do any diagnosis until 7.
Why is that?
Well, so it's maturity of the auditory system and norms. So we have some good screening tests that can screen at like age 5 up to almost age 7. But from a diagnostic standpoint, the auditory system just isn't mature enough to really say, okay, these are the milestones that you're not hitting yet.
Makes sense.
And even at 7, if I do diagnose a child at age 7, I always tell the parents, like, this could just be a maturity thing. Like 30% of the ones that we see, it's just maturity, so you have the diagnosis now, but you could totally outgrow this. But the majority it's not just a maturity thing. It's, the auditory system, it just isn't performing the way it should be.
Right.
But they come in, and we do have to rule out hearing loss. So we do the beep test, where they actually get to push a button or raise their hand. And then they, depending on their age, we're going to do the whole battery of testing in one section, which we do a 2-hour block. If they're closer to age 7, or if their parents just know that's too much for them, then we might do 1 hour and then, a couple hours of break, and then they'd come back and we'd finish. Or I have had it where it's like one day we do an hour, and then the next day they come back and do it. but most of the time it's in a 2-hour block. And so we do some tests to see if the eardrum is moving properly, and all that kind of stuff before we get into the auditory processing is takes about 10 minutes.
Okay.
And then the rest of the time is just tests that specifically are trying to push you to the limits of your auditory processing ability. So they're very difficult listening tests, and we break them up and try to make them as fun as we can, but you know, they're difficult tests.
Mm-hmm. Nobody likes tests.
Yeah, nobody likes tests. Yeah, and with these, you know, they're listening to things. Most of the time, they're listening to something that's speech or speech-like, and some of them are music, and those ones are more fun. But they're always listening to something and then explaining what they heard, or mimicking what they heard, or something like that, or pointing to what they heard. So that's the testing part. And then, you know, it's all based on norms and where they fell compared to where we expect them to fall for their age. So it's pretty clear cut, like they either, you know, it's pass fail, or, you know, in some tests, or it's you're within 25th percentile or 90th percentile for where you should be.
Okay. So you can give some data to pick.
Yeah, it's data. Yes. Yeah. I always actually say that the first day they come in, I go, this is data day. We're just collecting it all. And then, you know, next time I see you, we'll have answers.
Yep. Okay. So as a speech therapist, obviously I see things that look a lot like auditory processing in many ways. And, you know, we're always collaborating with the school, and sometimes the teachers will bring up concerns, or the parents, or the case managers, or the psychologists. So, yeah, a lot of the concerns that we get are they can't follow directions. You know, multi-step directions are really difficult. Sometimes we will see, you know, specifically in certain classrooms, he or she has a harder time. You know, it seems like after we say something, there's a really long pause before they respond, or we see them using a lot of non-specific vocabulary. So those are kinds of some of the things that we hear about as primary concerns. So I know in our field, there's a lot of like disconnect between putting those pieces together. So I wanted to just chat with you a little bit about how, you know, SLPs, school-based personnel, psychologists, and audiologists can kind of work together to figure out what is going on with kids, and hopefully like clear up some of the confusion between like what is a language processing challenge and what is an auditory processing challenge, because to us it seems kind of obvious, but and sometimes not, actually, let's say. Sometimes not. But I know to a lot of families, kids, and, you know, even not being able to describe what's happening in an, you know, an older child can't really even figure out what specifically is giving them trouble. So yeah, so what are your thoughts on that and what you've learned and heard and come into contact with?
Yeah, so I think it's easier on my end, because, like I said, we have these tools and tests that we can just test the auditory system and see, and we try to take the language portion out of it as much as we can during the testing, although there's no way to not have language in the testing. And so, but from a perspective of like really just trying to separate it, my go-to with that, and I'll give you some resources that I think no one explains it better than her, Dr. Ferry. So it's Ferre, and she has a great YouTube video, and it's called The Differential Diagnosis of Central Auditory Processing Disorder. But she has this great diagram in it, and it really breaks it down into the auditory portion of processing and then the language portion of processing. And so for the auditory portion, you know, we're in charge of deciding, is this a problem with them first detecting the signal, which would be hearing loss. So we say, okay, it's not hearing loss. We've ruled that out. The ability to analyze the signal. So if it comes in as k, a, b, are they mixing the C up with the T, or are they consistently making those discrimination errors? And then the ability to synthesize the k, a, B into cab, just to know that that's the pattern that they heard of those sounds. And then after that, it's going over to the language center to say, okay, cab is a yellow vehicle that comes in, although we don't have cabs anymore, they're Ubers, but, you know, to put the meaning into that word. And so it's really trying to see, you know, and some of it's not, you're not going to pick up from the teacher. They're not going to see those fine differences. But when you get your first chance to see them, there's screener tools that you can use. I know TAP's one of them that you guys might use.
We do.
Specifically the discrimination portion of that is called like the discrimination subtest or something of CAPS. That would be the one that you'd want to pay the most attention to for the auditory portion of. I know the test is called the test of auditory processing, but really if we're talking about auditory processing, like that's more of our concern from what you guys can do. And then, you know, we have like the surveys or things that parents can complete to just see if they have enough characteristics that fall into that. But those are the differences. Like if they're having more problems that seem like they're not able to execute a response or things like that, it could be either. That pause could be that they can't locate the word that they're looking for, but it came in okay. It could be that they're just taking longer to process it from an auditory perspective, and that's what the lag is. So it can be impossible when you're looking at the child or observing the child to see, you know, this is auditory processing versus language processing.
Okay.
But I think, you know, using the tools that we have and ruling out.
Yep. So would you say that if we see a child with phonological errors and challenges, it's always good to rule out an auditory processing disorder before we get started with treatment?
Yeah, I would, at least and that's what I'm really trying to work on, is a way to just do that type of a screening without having to put them through a 2-hour evaluation. But yeah, and especially like if you can do like, you know, minimal difference sounds, and if they're mixing up the sounds, or if you're doing nonsense words, and they're not, you know, if it's a nonsense word, they should still get the sounds correct. And if they're just not getting the sounds correct, then that's a big flag for auditory processing.
Okay, good to know.
They might not, you know, be able to put a meaning to the word, or obviously if it's a nonsense word, it doesn't matter, but if the sound's correct.
Right. Okay. So is there anything else you think, you know, as speech therapists, we should know about auditory processing disorder that, you know, would kind of help us? Because we work with children with auditory processing disorder.
Right.
A lot of times there are things that we can do therapeutically to assist,
Absolutely.
as well as obviously all the accommodations and modifications that are made in schools. What would be some advice for us that you would have as an audiologist?
SLPs are the best equipped to work on the therapeutic part, in my opinion. You know, audiologists can do it too, but weren't trained to do that intervention type protocol and making goals and going, you know, actually creating lesson plans and things like that. We know what needs to be worked on, but so I think SLPs are the best to do that, and that's who tends to work with these kids. And so I think part of it is just going for it. You know, I think there's the confidence thing with anyone when you're doing something different and you're just not sure what you should be doing. I'd say if you haven't done it yet and you're afraid to do it, please just go for it. I'd be happy to help you with resources, and there's some great tools out there that are pretty much toolkits to just say, do this, and then do this. There's courses you can take.
Awesome.
But you know, I think we just have to work together and keep checking in and seeing if, you know, if what we talked about is working, and then recheck, and then, you know, and there's some great computer-based programs too, but I'm always going to promote working one-on-one with someone who can actually watch what's happening versus a computer-based where they can sort of fudge their way through it and stuff like that. I think those are great resources that parents can use But I think SLPs are the way to go for the therapy part.
Absolutely. Yeah. And it does trickle over into kind of literacy interventions and, language and reading comprehension and all of that too. So, which is a lot of what we're working on with our school aged kids. So,
And now with the telehealth stuff, I know like part of it can just be time, and I'm assuming the same as with speech therapy, but with auditory therapy, it's like we should really be able to achieve pretty good success in, like 30 to 40 hours of time. But the more concentrated we can get it, if we could do it, 15 minutes a day versus in 1 hour, one time a week, 15 minutes a day would be well preferred. It's just that we haven't been able to do that. So I think with telehealth, that could be a huge opportunity to,
absolutely.
work.
Yeah. I mean, I think we've noticed already with providing these services that you just cut out some drive time and it makes it so much more accessible for a lot of families. The schedule has just opened up so much. I mean, not to mention that they're not in school, but yeah, I think it is a huge factor. And we are seeing like a lot of kids just need that repetition with everything that we're doing. And, the increase in frequency over multiple days can, really help those, strategies that they're developing. So,
yeah, absolutely.
It's been fun so far. That's for sure.
Sometimes you got to be forced into it to dip your toe in.
Exactly. And that's what I tell, any family who's skeptical is like, oh, speech therapists have been doing this for years, but we're just a little late to the game, and, we're doing it now and we're seeing a lot of the benefits. So, in the little video that you provided me, I don't want to not touch on these things. You went over some of the, benefits and, pros and cons of teletherapy, telemedicine, whatever word you want to use, to children with auditory processing disorder. And I hoped you could just touch on that a little bit so we can.
Yeah, absolutely. So, I just know my son's experience. I don't know what everyone else is going through. And we have a pretty quiet house. He's the only child. So when I look at, a classroom that was 26, then they had 17 boys in their class. So he just had a crazy classroom. Fifth grader. So now like and he doesn't have auditory processing disorder, although I've tested him a bunch of times for it. But like his learning environment is now very quiet, which for a kid with auditory processing, that's huge. I mean, the amount of, if you're already having a trouble discriminating and perfectly quiet, you add background noise and distractions, and it's just
the paper airplanes.
Impossible. Yeah, you can't do it. So to control the environment, that's part of like what we'd recommend if they were in a classroom is, as much as you can control the environment, which is really so much to ask on a teacher, but so that's definitely a benefit. If they can wear headphones and block out even other background noise, and being able to go at their speed, I think that's a huge benefit, because a lot of times they just take longer to process it, they take longer to get started on something, they take longer to finish something. And so I find that to be nice. You can do your work at your own pace, which is nice for them, maybe not so nice for the parents if they're going to have to, help get them started. That may be, another something to add to their plate. But the downsides, definitely can depend on the quality of the signal coming in, how much background noise is in, the environment of the teacher teaching. So if you had kids running around or dogs barking, then there's just noise coming from the actual target signal. Just maybe not the ability to have that if the teacher can't probably see all the kids at once, like on this, that you lose that personal interaction of the teacher saying, oh, well, I see the blank look, I can tell I need to go help. So there's
I'm sure a lot of these kids have developed some strategies for making it seem like they are a part of everything, particularly with kind of watching their peers and seeing what their peers are doing. So if they're, they can't see all their peers, it's a whole new ball game.
Yeah, absolutely. And I know even my son, like he'll, you know, it's just open for interpretation too. So you read the assignment and he interprets it, and then he asks me and I look at it and I interpret it differently. And so, you know, obviously there's a lot of ways it can go sideways.
Yep. Yeah. Okay. Well, thank you so much for sharing all of that. Is there anything else you want us to know about the specifics of the field that you love and have dedicated so much of your time and education to?
No, I just, like I said, I think the more people who can help with the diagnosis of it. So I'm always encouraging other audiologists to do it, and the more people who can help with the treatment of it, I think that would be fantastic, because it is a struggle. The driving part is really hard for parents. You know, I have parents driving from Duluth and stuff like that, and it's just not realistic long term to try to do that. So the more people who can do it, or if they can do it telehealth, is awesome. And then just like from a therapy approach, you know, working on like the bottom up, which is the auditory stuff, and then the top down together. I think that's the most successful part of it, is, you know, working on the language part of it as well as the auditory.
Using those skills, using the context to really help figure out, you know, what's happening at the lower levels.
Absolutely.
So awesome. Well, thank you. Lastly, just like, what if someone has a question about auditory processing disorder, what is the best way for them to kind of reach out to you and ask their questions? Or
totally. So anyone can, you can email me directly. So you can email me at drcourtney.stone@gmail.com. You can check out my website, which is www.acornaudiology.com. And then you can also email through that. So those are the two best ways. I still take phone calls. So you can find my phone on the website.
Okay.
And then I'm just going to start be putting more stuff up there. I made this. You inspired me to make this, which you probably can't see.
Oh, I love it.
It's a pretty version of signs based on like age group.
I like the bullet.
So,
I like bullets.
Yes, I'll send that to you, which that can be something that they can click on. And so I'm going to start making more and more just stuff like that.
Ask your favorite Sunny Day speech therapist for more information as well.
Yes, absolutely.
Okay. Well, thank you so much for taking the time. I'm going to use my technology skills to stop this recording, but hopefully you'll still be there. All right. Thanks, everybody. Remember, if you have any questions about auditory processing, you can contact myself, Miranda, or Courtney, or any of your Sunny Day speech therapists. We look forward to working with you. Bye.